Hey guys, Dr. Kirk with Minot Chiropractic. So I just wanted to touch on something that not a lot of people know that we treat and we see quite often is issues with the elbow. So the elbow is kind of a unique joint. The anatomy sits with the bony anatomy. We have our radius, our ulna, and then our humerus. Those three kind of all interact to make motion happen at the elbow. We have the radius sits on the outer part of the elbow out here, and then it has a little head, and then around that head is the annular ligament. It's kind of a unique joint because it allows a lot of rotation to happen at that joint because the radial head can kind of spin in there. So it kind of moves like this. So that's actually a really nice and important motion to have because when we think of the elbow, a lot of people think, flexion, extension. That's the main motions at the elbow for a lot of people. But what people don't realize is we also have a lot of rotation afforded to us. So if we're to look at kind of the things that we look at with an elbow from like a movement perspective or a function perspective, we look at flexion, we look at extension, but we also look at rotation. So pronation, supination. Okay. So if we're in supination here and we come into flexion, we can kind of go through what we would call elbow cars. So that takes you through a full range of motion, kind of hitting on all the different ranges that can be restricted or can be causing issues in the elbow. By far, the most common conditions that we see in the elbow are medial epicondylitis and lateral epicondylitis. These are your classic golfer's elbow and tennis elbow. In tennis elbow, we got the outer part here, lateral epicondylitis, and that's actually the extensor tendons that attach into the outer part of the elbow. And then that tendon specifically in the extensor carpi radialis brevis muscle, that's the one that's usually the most involved in tennis elbow. And then on the medial side, on the inside, we have golfer's elbow, and that's from actually the flexor tendons in the elbow that go down to the hand here. So the first thing we'll do from a treatment perspective is we'll look at things up and down the chain. So we'll always check out the shoulder. If you lack rotation in the shoulder, you got to get it from somewhere else. That usually comes from the next segment down, which would be the elbow. So we do check that. We check the actual movement at the elbow joint, and then we check the wrist as well. So these tissues, again, are the ones that attach into the elbow. Well, we need to know exactly where they attach, and then we need to know where they go to be able to perform some treatments to, if those tissues are too tight, to loosen them up. People that work with their hands a lot, they're a little more prone to things like this. Or if you tend to be on your phone a lot, that can lead to issues. And then obviously like sports related, you can see it with tennis, although that's probably not the most common one we see. Golfer's elbow is the medial side, but I've seen plenty of golfers have issues on the outer side of the elbow as well. So it's just important to understand like what's going on with those things and then the treatments that we can use. In terms of things we do some myofascial release in and around the tendon and then kind of distal up in the forearm flexors or extensors, depending on which condition we're treating. We do some dry needling in that area. That tends to work really well. We started incorporating the laser more and more too, because the laser can really flush out some inflammation. So it gives results quicker, which all of our patients are really, really interested in. They want to get better as fast as possible. And then our rehab's really going to depend on what's going on with the joint, because let's say we have a lack of supination. Well, we really need to work on restoring that supination. So that's where our rehab's going to start. We start with what's going on at the local joint level, and then we can move more distal from there, and we can look at kind of more global movement patterns to start to load the tissue. But really, if you have something like, let's say, medial epicondylitis, you lack supination, well, we really need to start to get range in there and then load that range so you can get better quicker and make your results last longer. So that's just a little rundown on the elbow. If anyone's having elbow issues, or if you have any questions about the elbow, feel free to shoot them in the comments below. And yeah, have a great day, guys.